All private healthcare consumers aspire to receive quality medical care at an affordable price, but can this objective realistically be achieved if one considers the motives of the dominant players competing against each other for a bigger slice of the same healthcare pie? Which player or brand should sacrifice a piece of their own financial reward to benefit another, and why would they even consider such a bizarre and commercially counterintuitive idea? My name is Conrad Smith, and I'm a medical practitioner. During the more than 2 decades that I have been in private practice, the GP's portion of the private healthcare budget was slowly reduced by almost 10%. During the same time, however, the patient's monthly contribution to medical aids has significantly increased. Where did all this money go? Not back in the patient's pocket. Perceived value is the worth that a product or service has in the mind of the consumer. This perception also determines how much a consumer is willing to pay. Being mostly uninterested in the true cost of production or service, consumers rely on a subconscious notion of whether it feels right to them. The perception of value originates from a series of cumulative events referred to as imprinting in psychological terms. Whilst personal experiences play a role, multiple externally derived cues that collectively contribute to imprinting are derived through several deliberate strategic processes. In an academic context, these can all be collated under one common heading: marketing. As in many countries, funding for private healthcare systems comes from the private healthcare consumers, the man on the street struggling to keep head above water. Since healthcare is an expensive necessity, any offer relating to reduced costs or better value for money will be highly appealing. In cyberspace, a great divide exists between patients and doctors. Patients largely function in communities where their opinions and purchasing decisions are influenced by targeted marketing and social media. Doctors, on the other hand, operate in silos that are poorly represented in cyberspace. One of the main reasons for this is that because legislation prevents doctors from advertising themselves or their profession, paradoxically, this rule does not apply to any of the other brands that compete for the same private healthcare funds. Through highly strategic marketing and advertising campaigns, often at huge expense, they reassure their customers that they are providing them with cost-effective quality care. By enhancing their own value, they inevitably diminish the value of their competition. With no digital footprint, public voice, or forum, the value of your brand as doctor is slowly being eroded. Modern patients are also modern consumers, more orientated towards self-service and self-help strategies. This means that more effective online marketing campaigns based around these concepts will start to exert a stronger influence on how they perceive value and what they will be prepared to pay for in future. Each second of the day, more medical information gets uploaded to cyberspace. Reliance on the internet has become a way of life, and digital information is now accessible to almost everyone on the planet. Since mobile has overtaken desktop, medical information is now immediately available to anyone at any time and place. In this environment, consumers are starting to expect that medical information should be provided as a free service. Essentially, medical internet activity can be divided into 2 categories, namely seeking healthcare information or healthcare service. Dr. Google does an impressive job at providing volumes of healthcare information. A search for abdominal pain, for example, delivers around 26 million results in under a second. How often do healthcare consumers use Dr. Google? Quite often, it seems. Search engine statistics suggest that medical matters are some of the most researched topics on the internet. WebMD alone reports 75 million unique visits a month. A recent poll found that 31% of younger consumers explore their symptoms online as a first step when feeling sick. Of those, a staggering 72% also investigated their diagnosis and treatment plan after a doctor's visit. But while the ease of access to this huge amount of data is truly remarkable, the content's depth, volume, and accuracy often proves overwhelming, perplexing, or even alarming to many consumers. In this context, information often proves too broad, too narrow, or even contradictory. This leaves patients free to misinterpret, exaggerate, or misconstrue medical information. Consequently, they can become anxious, distrustful, or even superstitious, a common problem that occurs when patients try to self-diagnose themselves. But despite the many shortcomings, research now also suggests that in many cases, internet opinions may be regarded by patients as being more reliable than those of their doctors. Although we doctors may not view this as a fair assessment, we still need to address this reality among ourselves. Healthcare service, the other category of medical information, is also taken care of by search engines. Within the private sector, a patient can find a healthcare provider within seconds. This inclination, however, has now led to a new consumer tendency, which we doctors may not be all that enthusiastic about. These sites are encouraging visitors to rate the doctor, a highly subjective process. Not only will it put more pressure on doctors, but this trend could actually have a detrimental effect on the quality of medical care. Within this rapidly changing environment, and with so many other dominant and competitive brands contending against you for your portion of private healthcare funds, the future role of doctors in private practice may not be all that secure. Working mostly on your own, we are isolated from a competitive commercial environment, and instead, decisions are made for us by others who are not members of our profession, mainly to benefit themselves, not necessarily our patients. How can we doctors secure the relevance and value of our profession as a united brand, whilst at the same time ensure that our patients still receive cost-effective and quality medical care? In the next video, I propose that collaboration among doctors, shared knowledge and collective intelligence will provide a possible solution.